A very good morning to everyone. I am presenting on interweaving structural and functional findings in MACTEL type 2. It was done at Joshi Eye Institute, Hubli. No financial disclosure. The objective of the study was multimodal imaging of eyes with MACTEL type 2A and correlation with staging systems by each modality, and to analyze the effect of various grades on multimodal imaging on visual function using multifocal ERG. So MACTEL type 2, as we all know, it is a neurodegenerative disorder that primarily affects the Mueller cells. Staging has been done basis on clinical findings, OCT, FAF, and FFA. Recently, Octa has given us insight about the deeper capillary plexus, which is mainly the origin of pathology of this disease. Coming to methods, it was a cross-sectional study conducted from May 2017 to 2019. Patients with MACTEL type 2A diagnosed clinically on SD-OCT, FFA, and FAF with Octa were included. Patient excluded were non-proliferative type of MACTEL, coexisting diabetic retinopathy, age-related CNVM, myopic CNVM, glaucoma, and optic nerve diseases. Slit lamp grading was done according to Gas et al. That was stage 1 to 5. Stage 1 is foveal and parafoveal graying. Stage 2 is the telangiectatic vessel. Stage 3 is the right angle dipping of the venule. Stage 4 is intraretinal pigment. Stage 5 is CNVM. OCT grading done according to Salo et al. That is grade 1, break in ISOS junction, confined temporal to the fovea. Grade 2, it has reached the foveal center. Grade 3, it is nasal and temporal to the fovea. And grade 4, any signs of neovascularization. FAF grading done according to Wong et al. Grade 1 is absence of normal reduced autofluorescence of fovea. Grade 2, mild increase in autofluorescence in parafoveal region. In grade 3, it is heterogeneous. FFA grading done according to Toto et al. Grade 1 is temporal changes. Grade 2 is temporal and nasal. Grade 3 is full involvement, and grade 4 any signs of neovascularization. Octa done according to the Toto et al. Classification. Grade 1 mainly the vascular anomalies is in the deep and or superficial plexus but temporal to the fovea. Grade 2 temporal and the nasal. Grade 3 is circumferential, and grade 4 is neovascularization. So we recorded individual MFERG responses for 61 hexagonal elements, and we have grouped in to R1 to R5. R1 was less than 2 degree, R2 was 2 to 5 degree, R3 was 5 to 10 degree, R4 was 10 to 15 degree, and more than 15 degree was R5. And we recorded average amplitude of P1 in all the rings and compared it with the controls. P1N1 ratio was significantly reduced in all the 4 rings except for R5. So we have divided the voltage of P1 into 4 quartiles, and with interquartile range being the same, so that we can correlate easily with the other imaging modalities. So we have divided into 4 stages. So coming to results, 29 eyes of 16 patients of MACTEL type 2 and 25 eyes of 19 normal patients. Mean age among patients was 57.4 years. 13 patients we included both the eyes. In 3 patients only 1 eye was included. And in mean BCVA was 0.038 plus minus 0.26. Clinically, we found graying of temporal retina was seen in 100% of the patient, followed by right angled venule. Staging, stage 4 was more common, that is intraretinal pigments. We also measured the EZ disruption length and ELM disruption length and compared it with MFERG. On SD-OCT and FAF, stage 3 was most common. On FFA and Octa also, stage 3 was most common. So this is a representative case with grading on OCT, that is grade 1, temporal involvement. On FAF, it is grade 2. And on OCT, again, it is temporal involvement. So OCTA, so it is grade 1. On MFERG, mainly the central ring that is more affected. The amplitude is more affected in central ring. And temporal is parafoveal segment was more affected than the nasal one. So SD-OCT correlated well with all the imaging modalities, but it was not significant with Octa. Similar with FAF, it correlated well with all the imaging modality except for Octa. But in contrast, FFA correlated well with all the imaging modalities, including Octa. Octa has positively correlated with all the imaging modalities, but it was only significant with FFA grading and R1P1 amplitude. And R1P1 amplitude has correlated positively and significantly with all the modalities. Coming to discussion, Okada et al., they have found MFERG preserve and responses. They have preserved N1, that means photoreceptor is not involved, and there's reduced P1, that means It suggests inner retinal dysfunction, and center and temporal part is more involved than the nasal part, and outer rings were not involved. But in contrast, Narayanan et al. They found that there was generalized reduction in P1 amplitude in all the rings. In our study, we have not found that. In R5, it was not significant. Toto et al. Had correlated various modality imaging, and they have found Octa has correlated well with all the imaging, but in our study, we have not found so. In Octa has only correlated with FFA and multifocal ERG. So coming to conclusions, to the best of our knowledge, it is the first study with structural and functional correlation using multimodal imaging. Octa can be a non-invasive marker for capillary abnormalities, and high correlation of R1 P1 amplitude with existing multimodal imaging can give us information about the foveal function in MACTEL type 2. Thank you, everyone.
Doctor, for these, the various things that you saw, the multimodal imaging, can any of these help you with the prognosis? Prognosticating a case?
Prognosis, mainly the multifocal ERG gives the functional assessment, and if we have compared it with best corrected visual acuity also, and we have found it has correlated positively with best corrected visual acuity.
But are you able to say that this particular case is going to progress faster than the other case based on your findings, based on these imagings?
No, ma'am. We have not found that. Only the EZ disruption and the ELM disruption that we have seen in higher stages.
Yeah, that's right.
So very impressive structure function correlation, as we mentioned earlier in the semi-final, in the preliminary round. Microperimetry would have been useful, but this is pretty impressive as such.
Thank you, sir.